Before we kick off our session, I'd like to take care of a few housekeeping items. And I have to apologize. If you've attended previous courses, you're going to hear this information many times. But for our newbies that we have on, here are a few things to know before we get started. So content, we're scheduled for 60 minutes of content with 10 to 15 minutes of Q&A at the end. And speaking of Q&A, we encourage your participation throughout the session, so please don't be shy. The Q&A box will remain on your screen throughout the presentation. Please type questions in any time. Also, if you have technical difficulties during the session, you can seek help in the Q&A box as well. Recordings, we'll be posting recordings daily in our Facebook group. There will be more info to come at the end of the presentation on how to join it, and we'll be sending an email at the end of each week with the recordings as well. CE, our goal is to offer CE credit for all courses. The evaluation and quiz will be sent after the course each day, and your certificates will be issued within about 1 to 2 weeks. So with that out of the way, it's my absolute pleasure to introduce our presenter for today, Dr. Doug Thompson. Dr. Thompson is an internationally recognized speaker and has completed hundreds of hours of continuing education at the Coy Center in Seattle, Washington. In 2015, he accepted a part-time faculty position teaching about personalized perio medicine, and in 2016, he added the wellness dentistry topic to his teaching role. In 2015, Dr. Thompson also founded the Wellness Dentistry Network, which is a community of dentists with a keen awareness of how oral conditions affect whole body health. He owns and runs an established private practice in Bloomfield Hills, Michigan, under the name Integrative Oral Medicine. He's absolutely an industry expert in perio medicine and continues to push towards a better overall standard of care for his patients. He has been a great partner to Caries Free. We worked together for many years, and we're so proud to continue that partnership. Before I turn it over, I'd also like to introduce another voice that you're going to hear on today's session. So we have Dr. Cooch joining us. He's the founder of Caries Free. Dr. Cooch also has an impressive resume, and we're lucky to have him as our resident Caries risk management expert. He's newly retired from private practice after 40-plus years, but he's managed to remain as busy as ever with giving back to his dental community and his speaking engagements. Dr. Cooch also continues publishing papers in journals. He acts as scientific advisor on dental caries for the prestigious Coy Center in Seattle, Washington, and he's scientific reviewer for multiple journals including JADA, Compendium, and Inside Dentistry. So these two bios only begin to scratch the surface of what these two have done for the dental community. But with that, I would like to turn it over to Dr. Cooch to officially hand it off to Dr. Thompson.
Thank you, Kendall, and welcome everybody. It's certainly my privilege and honor to have Doug Thompson with us today. I met Doug probably in 2001 when I first started going through the course continuum, and we became good friends. And I have to tell you, watching Doug work with periodontal disease and what he has done in terms of wellness is spectacular. And he has collected more long-term data on patient outcomes than anybody that I know of clinically. So, and on top of that, he's a great speaker, and he is also, this is a little-known fact, the first award winner of the Jim Bridger Award from the prestigious Rendezvous Dental Meeting. So, Doug, take it away. We're excited.
Thanks so much, Kim. I can't believe you brought up the award process, but I'll have to let people know as we go along how that happened. You know, one of the things that we're trying to define, and obviously we're really struggling right now with what's going on in the world, is what is good health. And, you know, not only do we want to be physically healthy, but we need to be mentally and have great social well-being. And health isn't just defined, you know, as the absence of disease, but we have to have some resiliency to bounce back from illness and problems. And what we're trying to do now is boost our immune system so that we don't get disease, because we're in a really strange time. And we know that genetics play in, our environment plays in, how we interact with other people, things we eat. These are all lifestyle issues. And so these have a huge component onto our health. But the interesting thing is that if you look in the bottom box on the screen on the left-hand side, Americans are still dying at a younger age and experience more illness than others. Now, obviously, these ideas were put together before we were in the middle of our current health crisis, but this is still something that we need to be aware of and that we're trying to change. And what happened with us in dentistry and in medicine is in 2004, we started to really learn about this inflammatory component of health and wellness and how it was so destructive. And we learned that from Time magazine. There's been better works and more consistent works written and more particular works about how medicine is, redefining this heart disease as an inflammatory disease of the blood vessels. So it's a very interesting thing. And the interesting component for us in dentistry is it's the bugs that live around the teeth that only we can control that affect this system. And so this is what propelled me into the whole periodontal disease world. And when I started to talk to my patients about periodontal disease and the effect on systemic health, I had to rebrand my practice because it was all integrated. And sure, I had people coming to me for, beautiful smiles and, healthy teeth. But when I started to talk to them about health and balance, they interacted with me differently. And it was really the genesis of a new idea. And I wasn't short of things to talk about because I had papers that showed now periodontal disease is being cross-referenced to 57 other systemic conditions. So it's not like you run out of things to talk about. It's just really a great opportunity for us in dentistry. And it's going to be a great opportunity. And what I want to focus on today is getting back into practice. And if you're not going to do it in person, you're going to do it over the phone. You're going to do it over the internet. There's going to be some way that we're going to be still instrumental in teaching and guiding our patients about health-related issues. Now, one of the things that we have to have in order to do that is an organized system for how we break down the human being and how we talk about these component parts, all these different things. And of course, we learned that at the Coy Center. And what we did is we took, I really, again, I'm going to tribute and say just a shout out to John Coy's because what John Coy's did for us was he gave us a patient evaluation system, a way to look at some person and dissect that into a meaningful synopsis. And so what he taught us was fields in the box on the right-hand side, and that you can see, if you can see my mouse or my cursor outlining this group of areas. This is what dentists would call these things. These are how when I'm talking to another dentist, I say, oh yeah, this person had a biomechanical failure, and they get what I mean. But when I'm talking to a person, I got to talk to them about cavities, or I got to talk to them about bite disease. I don't mention the word function. So you know what I mean. We have to make these topics consumer friendly. But I thank John for doing that for us, because that's what he did. And we built on that, and we created a system around an awareness about how these dental conditions, purely dental conditions, how they affected our overall health. And that's why today, the title of this presentation is, wellness dentistry in the midst of a health revolution. We are in a health revolution, and we were in a big health revolution, and now we're in survival mode. And once we come out of survival mode, we'll be back into a health revolution. If we have any kind of little glitch, it's not going to be a problem. We'll be able to go right back to it, because we have little bits of internet outages. We have the Zoom platform, or platforms that we're using right now, are internet dependent, and everyone needs to be patient with that. That's just how it is, and we're getting through these tumultuous times. Internet bandwidth has never been trusted. Yep, Kim?
I was going to say, Doug, I think we got way too many people are at home trying to stream the Tiger King right now.
That's it. So yeah, but so we'll manage and we'll get through that. So these areas on the left are specifically areas to dentistry, but look at the right side of the screen. And on the right side of the screen, I was thinking, you know, if you had a little bit of knowledge, you could help your patients with a lot of these things. Now, in dentistry, two specific areas to dentistry that really relate beautifully are gum disease and sleep apnea. So we see those two things. But today, what I'm going to do is I'm not going to talk about many of the things on the left-hand side of the screen. And what I want to focus on are the metabolic issues that are circled on the top right of the screen.
Dr. Thompson? Oh, it looks like, hey everyone, this is Kendall. It looks like we've lost the connection with Dr. Thompson again, so he's getting logged back in.
Yeah, and it's okay, Kendall. I just don't know. If there's not much I can do on my end to help with the internet connection. But we'll this is what I want to focus on today.
No, you're okay.
Yep, are these two issues, and that's what we're going to do. And here's the key piece. The key piece about these issues are the common link with degradation in health is inflammatory issues, inflammation, and how this cascade of issues are causing inflammation. And if you even look at this current COVID issue, this COVID-19 that we get from the coronavirus 2, SARS coronavirus 2, it causes a cytokine cascade, and it overburdens our body with inflammatory tissue in the lungs, and we have respiratory issues. This is what's happening. So what I'd like you to think about is in our environment, everything we do is either inflammatory or anti-inflammatory. Every bite of food, every inflammation, dehydration, excess stress, adipose tissue, too much exercise, toxins, pathogens, you get the idea. There's a lot of things that are inflammatory, and we have very sophisticated scientific papers, and I'm going to allude to an older one on the right-hand side of your screen that tells us and reminds us that inflammation is the cause of coronary heart disease. That's really the idea. And in my studies and in my learning about this, I reached out to the American Academy of Anti-Aging, Functional Regenerative Medicine, and that whole continuum, the year I went and really studied this hard, I started in 2010, 2011, was inflammation and the effects on the body. So what a great opportunity for us in medicine to focus on this and realizing that it's only 8 risks in behavior in our lives. And if you look at these: diet, inactivity, smoking, lack of health screening, poor stress management, poor standard of care, insufficient sleep, excess alcohol. If you could manage only those things, 80% of the total healthcare costs for chronic diseases would be eliminated. I mean, that's huge because there's so much we can do. But the reality is not a lot of us do that, and we don't do all 8. We might have 1 or 2 of those nailed down, but we don't have all 8. And so what I try to continue to guide our people to think about, and for you to think about, is when we think about disease detection, if we want to detect disease early, we need to have more sophisticated biomarkers. We need to have better metrics. And often if you learn about something early, treating it's easy. But if you detect it late, treating it can be very hard. And so another thing that's happening is the money that we spend on healthcare is we spend way too much keeping dying people alive and not too much keeping the living patient well. So where our focus is going to be as we exit this crisis, our focus is going to be how can we live better, healthier, and how can we be more disease resistant. That's going to be key for the future. Kim actually brought this to my attention some time ago, but this movement in Seattle that started by Leroy Hood and this institute called P4 Medicine. And the idea behind P4 Medicine, I put a couple things on the screen about it, but the idea about it, the goal is to help you understand some of your personalized medical metrics. And what I'm going to talk about today are personalized medical metrics and how your body responds. That's the key piece. And when you look at the foundation of the P4 Medicine Institute, what is it? It's continuous monitoring of some health data. It's coaching wellness care. It's absolutely personalized. It has to be personalized, and it empowers us to be participatory. That's the key. We have to be participatory. And if you look at the programs that are designed to have these key pieces in mind, look what it is. The first program for a very inexpensive price is you can have a guided continuous glucose monitor put into your body or onto your body, and you can have them help you monitor that. And what will you get out of that? You'll learn some metrics, and they call that the cardio metabolic reboot. If you want, or actually they call that, that's just some basic level input. If you want this cardio metabolic reboot, it's going to give you a little bit more data, but it's going to be a little more expensive. You can see now it's $5,000, and you have to buy the continuous glucose monitor extra. And then if you want a year of guidance, now you're looking at $15,000. So the reality is these personalized approaches are getting more and more popular, and you got to pay for it, but they're getting more and more popular, and they're important. What I want to show you how to do is how we do some of the stuff in our dental practice and how we can use our dental practices as a way to help do that. So today, if I look at the objectives in the course description, it's still a theme that I've been big about forever. And Kim alluded to it in the introduction, how we use metrics or measurables as they relate to certain areas of our health. Why? Not only because of the relationship with periodontal disease, but overall health, as we've outlined. And so these metabolic issues and concepts in nutrition are going to be the focus of this segment. And if we have some small little technical issues, we might go a little bit long, but just bear with us, because the message is still going to be clear no matter how many times I have to reshare my screen. We're going to be persistent, and we're going to get through it. A couple of the objectives were, I want you to recognize how many topics related to health and wellness that can be easily discussed and coached in the dental practice. I mean, there's a lot of things we can do. And then I want you to learn some effective ways to measure blood glucose for you, things you can do, and how your body reacts to certain types of foods. That's going to be important. It's similar to what they're doing at the P4 Institute. And then there's this little tiny molecule in your body that's a gas called nitric oxide. And I just want to bring some concepts to think about. And so you can be educated about, and you can start to hear a little bit about it. And these are things that no one can live without, and how a lack of nitric oxide could be the root cause of a lot of chronic disease. So what I'd like to do is jump into that and start with those areas. And ironically, almost 6 years ago or more, actually it's probably more than that now, we developed a Wellness Dentistry Network. And in the Wellness Dentistry Network, if you're a member of our network and you log in, you'll see this Office Forms Tool Dental Library. Well, I didn't know it at the time. I was just looking at the A4M medicine program, and I started to think of a way that I could help teach dentists how to have pertinent discussions with patients in all these different areas. And you'll notice the first 8 areas are dentistry. This is all dentistry. But from number 9 all the way through to number 23, these are all learning modules that are very much outside of dentistry, but oh no, they're not. They're very much connected to dentistry in an intricate way. And what my goal is for the remainder of my lifetime is to teach dentists all ages how to make how to have intelligent conversations about these things in practice. Now, in January of 2019, it's archived on the Carry Free webinar website. I did a program called Death to Pathogens, Disinfection Strategies That Work. It was a very well-attended program, and we shared a lot of information, and this was all perio. So if you really want to learn about periodontal medicine and more about perio, please reference that, because I'm not going to go into that piece today. I do want to talk about how in our normal teaching and our wellness programs that go for days, sometimes 4 days, how we have this heart disease and brain health part, but today I'm going to move into diabetes and early identification of metabolic disorders, and we're going to talk about nutrition. But I want to say a couple things about heart disease and brain health, because you're going to see me alluding back to some of these concepts as we go. And here's the big piece. We know the bugs around the teeth affect inflammation. We know the bugs around the teeth affect our gum and bone that support the teeth. But many of us are starting to understand and are beginning to understand the significance of inflammation and how the bacteria around our teeth, yeast and viruses, affect vascular biology. And in fact, these people, whether it's Brad Bale and Amy Doneen, which many of you know, or whether it's Mark Houston, who we just had the privilege of putting a chapter in an integrative cardiovascular medicine textbook, or whomever it is, Joel Kahn, my good friend from Detroit, whoever it is, they want to know what is the inflammatory status of our patients. That's going to be the key piece. What's the inflammatory status of the patients? And they cannot manage vascular disease without a comprehensive oral inflammatory illness evaluation. And only we can do that. Dentists are the only ones that can do that. There's nobody else that can do it any better than us. So you're necessary, you're needed, and it's very important. And I just wanted to mention that whether you're looking at a healthy artery that is highlighted on the left, or if you're looking at an artery that has some fat in the wall, or if you're looking at an artery that's very unstable and is at risk for an acute heart attack event, in our heart disease module and other modules, and I'd be happy to come back and do another piece on these areas in particular, but there's certain biomarkers that we can measure that are on top of the black line that will help us understand what's happening in this vascular disease process. And what this image is this is an image of a cutaway of a heart vessel at various stages of disease. And whether it's early disease way over on the left, or whether it's asymptomatic disease, which is the biggest red circle, or if it's a very, very end stage disease where you're going to have a cardiac event, there's biomarkers that can be measured. And so we want to measure some of these biomarkers. And the endothelium is the skin lining inside this vessel. And this is key piece, because when we get to the nutritional component, you're going to see references back to endothelial dysfunction or endothelial function. That's the idea. And in the brain, believe me, if it's going on in your heart vessels, it's going on in your brain vessels as well. So let's talk a little bit about this metabolic health issue. The metabolic health covers 3 areas: metabolic syndrome, insulin resistance, and diabetes. And you can help your patients discover their journey with each one of these issues by just knowing a few things. Now, in our library, we have 3 modules dedicated to metabolic issues. And that's why, because these are somewhat cumulative. Metabolic syndrome doesn't always go to become insulin resistance, and insulin resistance doesn't always go on to become diabetes, but most people start in a stage of metabolic syndrome and it advances from there. That's the idea. So how do you diagnose metabolic syndrome? And what kind of easy tools could you use in the dental practice to either look at somebody or to just get a little bit of base information to know if they have metabolic syndrome. Well, what it is, it's really a cluster of 3 particular conditions, and those conditions are, it's having 3 of these 7 different conditions, and it's waist circumference. And in the chart on the right, you can see if you're a man or a woman and your waist is over 40, and you have 2 or more of these other areas, and it'd be triglycerides, HDL, blood pressure, fasting glucose, A1C, or genetics. If your patients know these numbers, then they can find out if they maybe have metabolic syndrome. Now, here's the beauty about metabolic syndrome. If you look at number 2 on the screen on the box on the left, no medicine, there's no pill that you can take that can undo the effects of metabolic syndrome as easily and rapidly as lifestyle change. So if you have somebody that's struggling from metabolic syndrome because they have 3 or more of these clinical measures, then you can ultimately really help them change their lives. So this is just something you need to be aware of. And we have a campaign in our practice called Know Your Numbers. It's kind of like Know Your Numbers, but we call it Health Measurables That Matter. And for our WDN members, we have a health measurable that matter for every one of our modules, because we want people to know these things. Because if they know these things, they can make a difference and they can make a change. So what if you have metabolic syndrome? Is it a big deal or not a big deal? Well, you have a 90% chance of going on to becoming insulin resistant. We also know that you have a 2 to 10 times greater risk of developing heart disease, 5 times more likely to develop diabetes, more common with people that are obese. But I want to reassure you, you cannot look at someone's body architecture and make a determination of how healthy they are. You just can't do that. You can only determine it by looking at the numbers. Because we have people that are very, even level 1 obese that have normal metabolics. So you have to look at the patient's internal numbers. And then you can reverse the syndrome. You can make a diagnosis from a couple easy questions or even visual observations. And then it does worsen in periodontal disease. By the way, if you're looking at sleep apnea right now, or you're looking at metabolic syndrome and you want to know if a man or a woman's waist is over a certain circumference, don't embarrass them by getting out a tape measure. Don't ask them to step on a scale unless they want to do that in a private place and you have comfort in knowing what to do with those numbers. Just take a ribbon or a string, cut it to the right length, and just say, I just want to see if this fits around your neck. Just do something really easy, and you'll know if the string doesn't fit, it's over that dimension. But you want to make it very non-invasive and very friendly. Insulin resistance is different. Insulin's secreted by our pancreas, and it's really the carrier for glucose in our blood. And it's supposed to take the glucose and park it into a safe place. But as we repeatedly bombard our body with sugar and things that are not so healthy and that kind of stuff, we overwhelm the system, and the insulin receptors either become overwhelmed or they don't work, and we become resistant to the insulin to be able to do its job. And we start to pack on pounds, and we add sugar because unused sugar, if your muscles can't use it, your belly finds a way to use it, and it makes fat. That's what it does. And so what happens if you overwork your pancreas? It all of a sudden says, oh, whoa, time out. I'm not doing this anymore. And now you have free-floating glucose in your blood, and you have problems, as well as too much insulin. So there's numbers that we can look at that would be diagnostic of insulin resistance, and we want to know those numbers. People that have elevated fasting blood glucose, you can do it from triglycerides, HDL ratio, our 1 hour and 2 hour glucose tolerance test if you're over these numbers, and your A1C, elevated A1C. But you can see A1C is only one small piece of this. There's a lot of other things that can be somewhat diagnostic for this. And so we want you to learn a little bit about that. And sometimes people will bring you only some limited lab data. And even with that limited lab data, you can often, tell a lot. So what we like to think about, and what I would encourage you to do, is snapshot the screen, or get this however you can, or come network with us. But this Blood Sugar 101 is a great book because it reminds us about how damaging poor metabolic control can be. And then if you have a Blood Sugar 101 book, and this is a consumer book, it's very easy. And if you have a simple glucometer, you can do some really cool things. And what we do is we teach our patients to get a glucometer, and for 3 days a week, for 2 weeks, you're going to measure your blood. And you take 4 measurements a day. You take one when you wake up, that's your fasting. And then you eat a meal, and you measure your blood 1 hour after the meal, and you measure your blood 2 hours after the meal. And then what you do is you look at all those numbers, you send them to your physician, you keep a little chart, you send them to your physician, and the physician can read the numbers and make a determination. And when we had one patient do this, these were the numbers that she submitted, and lo and behold, she was 71. She already had a history of a stroke. Her physician said her blood levels were fine. However, she had numbers that were relatively alarming and suggestive that she could use some help. So, and one of the things that I wanted to mention when I mentioned this story is that we have reference ranges in the United States that we think are good to keep people in that represent biomarkers of health. I would like to think more about getting to the optimal point inside that reference range. And what we've done is we've stretched those reference ranges to include more people in the normal level, but depending upon where you look, what metrics you use, you may be out of the reference range. So I don't like anybody at the far ends of reference ranges. We want to be optimal. I also want to know that we have an opportunity in dentistry to broaden our services. And this is going to be coming up much, much more. And as a matter of fact, we just created an interesting way for patients to get salivary diagnostics at home. It's called homedentalexam.com. And the idea is I want to make sure physicians and patients have a way to get salivary diagnostics testing in the comfort of their own home. What this means is we're going to be broadening our services, and we're going to be doing more web-based training and teaching, more web-based coaching. My colleague Aaron has a coaching service for weight loss and obesity management through nutrition. There's a lot of cool things we can do. What we also can do is we're going to start to bill and be able to be reimbursed for these things. And this is something that's recognized now, HbA1c, in our dental office. And so we have ADA codes for it. But what we need to learn is some of the concepts on the left or on the right side of the screen, which are the medical codes, which are diagnostic for things that we could bill for. So dentists are going to be broadening their focus to address other areas of overall health. And I think this is a great opportunity for hygienists, assistants, anybody to go out and get some health coaching input and begin to not only teach our patients, but in time we'll be able to bill our patients. And I know some practices are doing that successfully, but we need all of our practices to be doing that successfully because it's the right thing to do. So when we look at insulin resistance, we're not just looking at A1C, and that A1C Now Professional that was on the last slide, that's a nice way to get A1C very easily in the office. But there's red flags that you can look at on your health histories. Red flags you can look at just by looking at somebody, and those are things like, HDL imbalances, fasting blood sugar over 88, A1C. You can see that elevated HSCRP. So start looking for these red flags, and when you see that, go and try to look at the metrics. These are simple metrics that you can get off of regular standard lab tests. So this is a way of doing this. Now, continuous glucose monitoring is what I wanted to talk about. And there's two major types right now. There's the Freestyle Libre. Your physician can write this for you. And there's the Dexcom G6. And there's a video. What you see on the screen on the right is me in a scrub top. And I actually go through a video, a 3 or 4 minute video that I'm not going to be able to play for you for sound purposes and internet stability and other things, but it's going to be attached to our handout materials, or Kendall's going to get it to you in some way. And in the video shows the installation of one of these glucose monitors, but they either go into your belly or your arm. And this one that I show you here is the freestyle, and it goes into the bottom of the arm. Very easy to do, but it's interesting. And I'm going to move past that. It's interesting because what you do is you get an app on your phone, and it transmits through Bluetooth through the app on your phone, and it gives you a readout of your blood glucose. But now it's continuous. So it's not a finger prick in the morning, and it's not 1 hour after your meal. It's continuous. And you can see spikes and curves in your blood sugar as you do different things through your day. And you'll get some average daily targets. There's a lot you can do with this, and I want to share with you a couple concepts about this. When you exercise, what's supposed to happen, and this is what I was doing this day, I was doing some exercise for about an hour. What's supposed to happen is your blood level starts out at a certain level, and as you exercise over the course of an hour, this is 9:09, 9:45, almost 10 o'clock, you can see that you're using your blood sugar and your glucose stores. That's what's supposed to happen. But if you exercise too rapidly, if you went out and did something that was way too stressful, what could happen is you could have this spike in your blood sugar because of cortisol or some other stress hormone that upsets your blood sugar balance. So you want to make sure when you're exercising, you're doing it moderately, and you're doing it in a way that your body can handle it. I often use a story about a marathon that I ran in 2013, and during that marathon, 3 people died on the course. And so the idea is sometimes we're exercising, we overdo it, and we're not in the condition that we think we are. The Dexcom G6 has some beautiful reporting. This is quite an expensive glucose monitor, but back to Leroy Hood and the P4 Medicine Institute, this would be some kind of monitor that they would want to use. And what you get is some beautiful overlay graphs that show you can set limits on the monitor as to where you want it to be, and you can get some beautiful overlay graphs about the input. And here's what I want to show you, and incredible data by the hour every day. So incredible data. The idea is just to show you the intensity that the reporting can be done at, and how great this reporting can be for health and awareness knowledge. But if you keep a diary of what you eat, what you can learn is what happens to your blood sugar as you're eating certain foods. And what's interesting about blood sugar management is it's not what you eat, it's how your body reacts to it, and the combination of foods that you eat that could spike or not spike your blood sugar. So this was an interesting experiment that I did, and I was totally experimenting while I'm doing all this. This was broccoli and chicken. However, it was broccoli and chicken that was delivered from an ethnic restaurant that had a heavy breading on it. And look what it does. It totally spikes the blood sugar. This is what popcorn does. This is a pure carbohydrate. It spikes blood sugar. But look what happens if I have some berries and I add some almonds to the berries. Now, berries will spike your blood sugar because they have natural fructose. But if you taper that with a protein like almonds, then you don't get that spike in blood sugar. And so what you do is you keep a diary, and then you look at your spikes and you see what happens. What does bread do? Bread's going to give you a tremendous flour. This is why they say avoid all the white stuff. Flour, rice, bread. You're going to get an incredible glucose spike. Now it'll come down, and if you start to have poor metabolics, this down curve will stretch out, and that's what's very unhealthy. And then what about caramel corn and pretzels? I had fun, by the way, doing this. I got to eat some really cool foods. But you can see it's not as high, but still quite a spike. Look at the berries and almonds curve again. Almost nothing. And then what about, again, flatbread? I tested at different times a day. Believe me, it's consistent. You get up in the night and you snack on some Doritos, or you eat bread, or you eat some of these things, you'll be surprised what happens to your blood sugar. And it's not healthy when your blood sugar is over 140. If it doesn't come right back down, it's not healthy. And we'd like for people to even keep it below that. So again, chocolate chip cookies, big high spike, rapid decline, but big high spike. And then what about something healthy? Salmon, butternut squash, asparagus in a salad. Almost no spike in the blood sugar at all. So this is why our concepts in dietary management are low refined carbohydrates, and some kind of lean and green meal. And a lean and green meal is not a lot of sugar. Got to be careful with salad dressings, things like that. So this is a concept in metabolics. What I'd like to do now is move on into an area of nutrition and talk a little bit more about nutrition, but a little differently. We know that if you optimize your diet, you can reduce gingival inflammation. And what do I mean by an optimized diet? About just what I explained. A diet low in carbs, rich in omegas, rich in vitamins, rich in fibers, you can have significantly reduced periodontal inflammation, and that's what this study was. We also have studies that talk about how the diet and the dietary choices we make modulate the inflammatory cascade. That's a kind of a cool thing. We also know diet affects our gene expression. So how cool is it that we have ways of determining or allowing food to help us metabolically? So in our network, we teach 5 kind of concepts. One is we think a Mediterranean diet is great. The DASH diet is also good, and this is a diet specifically for hypertensive people. And my question about the Mediterranean diet is I want to consider, why does it work? Is it because there's antioxidants in the food, or is it because our body has the ability to transform antioxidants that are in the food? We'll answer that question later because nitric oxide is necessary for that. We also have something called time-restricted feeding, fasting or fasting mimicking, a liver detoxification program, and weight management. These are all for a later discussion. I want to focus now on this nitric oxide piece. It was brought to my attention by a book that was written about nitric oxide by Dr. Nathan Bryan. And I wanted to look at it and see what is in this book that's so interesting about nitric oxide. And what is nitric oxide? It's a gas. It happens very quickly in a split millisecond, but your body needs to continually make it and utilize it and have a source for it. And it's a signaling molecule, and it's necessary for a lot of things. It has effect in all of our systems, and it basically allows cell-to-cell communication. It helps our immune cells kill bacteria, viruses, and other things. And it's a very potent vasodilator, reduces blood pressure, decreases oxidative stress. I mean, it does a lot of stuff. Every single chronic disease involves either the loss of nitric oxide or the loss of nitric oxide helps propel 3 responses to inflammation. We started this discussion with inflammation, and here's what you get if you have too much inflammation. You either have more pure inflammation that creates this cytokine cascade, you have oxidative stress, which leads to more inflammation, or you have vascular immune dysfunction. What does that mean? That's the vascular biology piece that affects cardiovascular health. That would be the vessels of your heart, and dementia and Alzheimer's, which would be the vessels of your brain. So anything you can do to improve this is going to help your heart, and it's going to help your brain. And what was this molecule, nitric oxide? What did it used to be called? Look at this name. Endothelium-derived relaxing factor. It used to relax the endothelium. That's why I had to show you what the endothelium was before we got started. And what does Nathan go on to say about this? In the box on the right-hand side of your screen, the top 10 causes of death. He lists them. 8 of these top 10 causes have a clear, indisputable mechanism related to nitric oxide production. So we need to figure out, how do we make it? How do we supply it? What happens to it? That's the whole deal. And in the last 100 years, it's one of the most important discoveries. And what's pictured on the left is Nathan and and I had a chance to spend some time with Mark Houston, who's the gentleman with the yellow tie on, and he's the editor of the Integrative Cardiovascular Medicine book, and we contributed chapter 28 that put periodontal disease on the map as it relates to, in Mark's book, as it relates to integrative cardiovascular care. And it's really an honor to be able to do that. So it's one of the most important molecules in the human body. It happens, it's the basis of a lot of chronic diseases. As we, a big part that I didn't know is as we age, we naturally lose the ability to produce it. So Nathan thinks it's a big part of aging. And we also know that new research has shown what makes it not happen and what makes it go wrong. And we know how to fix it. So, I mean, what a great opportunity for us. So it's made by two pathways. One is the endothelium, which is the blood vessels of our vessels. It's the lining of our blood vessels. It's made by the endothelial cells, which I've talked about, and it uses basically a nitric oxide synthase, an L-arginine, and we lose our ability to make it. And there's another thing that blocks our ability to make it. If you have a mutation of the MTHFR gene, and this is called the methylation pathway, and some people will know about it and some people won't. You can find it out very easily on many genetic tests. But if you have that gene mutation, then you don't make it as well. And so that's going to be important as we advance. The another way that we make it is from healthy bacteria that live on our tongue. And this is interesting to me because our diet and commensal organisms in the oral environment, what they do is they take dietary nitrate, and you get that from green leafy vegetables. That's what this plate's about. You get it from foods. You can also get it from processed meats. You get it from healthy, you get it from things that are healthy that you eat. And organisms on our tongue convert the nitrate to nitrite and then convert it to nitric oxide. So some nitric oxide is made on our tongue. My friends and the literature, my friends Steve Acker and Nancy Hartrick in the literature would say it's also made in the paranasal sinuses in your nose when you nasal breathe. This is why we don't want people mouth breathing. And then what happens is, since all the nitric oxide can't be made on the tongue because the food goes past the tongue pretty quickly, you need the right amount of acid in your stomach to further break down the nitrates to nitrites, and with the stomach acid, and then it's recirculated and taken back up in the duodenum, and it comes back up through the parotid glands, and your body secretes this nitrite-rich saliva that now doesn't need to be broken down in your tongue, and the bacteria on your tongue make the nitric oxide much more readily. The idea is this is the cycle, and this cycle is very unique to us, and so nitric oxide is made here, and it's made in the blood vessels. And the diet pathway is very important in people over 40. Why? Because you can't make it anymore by your blood vessels. You lose the ability. Now, I didn't recognize this, but my buddy Joel Kahn, who's also a cardiologist, on page 87 of his book called The Whole Heart Solution, he has this recipe, and it's called Natural Nitrates on a Plate. And when I saw this recipe, I didn't really know what it meant, but now I have a whole different understanding of what it means. Joel's telling us to eat green leafy vegetables, but what I didn't know is the green leafy vegetables are just a source for nitrite. Our body then has to take those green leafy vegetables, and through the appropriate amount of stomach acid, through the appropriate amount of bacteria on our tongue, break that down into nitrites, which further gets converted to nitric oxide, which our body's using all day long to exist. That's the idea. So I have a lot more respect for Joel's recipe. Now, the question that I wanted to ask is, hey, if we can make this stuff, if we need it, how can we measure it? What can we do to measure it? And there's a few ways. For some of you that have heard my module on heart disease and brain health, you know that as part of our Wellness Dentistry Network, we look at some blood biomarkers for cardiovascular health. One of those is called ADMA and SDMA and microalbumin creatinine ratio. I just want to let you know that if you have ADMA and it's elevated, what the ADMA does is it scavenges the nitric oxide or the synthase that's needed in the endothelial cells to make nitric oxide. So if you have elevated ADMA, it's a way to tell that you could be deficient on nitric oxide. If you have elevated microalbumin creatinine ratio, that tells you you have elevated or you have endothelium that might not be working properly. It might not have the right kind of food, which is what? Nitric oxide. So that's what these blood tests tell you. There's also an indicator strip that you can use to tell about a patient's whole body level of nitric oxide. And this is an instantaneous test you can do in the office. And then there's another thing you can do. You can use what we call pulse wave. It's called pulse wave plasmography to look at computerized arterial pulse wave analysis to look at how elastic your blood vessels are and to see how compliant they are. And if you have stiff vessels, you might not have enough nitric oxide. So here's my question. There are ways to measure it. What can we do in our dental practices to determine if our patients could have this? Well, we could use our Wellness Dentistry Network lab panel. That would help us. You could get this machine. It's not that expensive. I have one. I've been looking at it. I could let you know and later on if it's worthwhile having it, but I think you could do it other ways. And then you could screen for it by using this indicator strip on the back of the tongue. And here's what we know for sure. If you have endothelial dysfunction and you have a methodology in your practice to screen for it, you could really help your patient because you could either refer them for further medical care, you could educate them, you could help them with lifestyle factors, you could help them learn more about their metabolics, lots you could do to help them out. So the screening for the bioavailability of nitric oxide can be done using this strip, and it's a simple color test. You look at these three colors, and it's really easy. Now, what will affect the nitric oxide on the tongue? You can imagine that what can affect it would be if you don't have the right bacteria. So what can affect the right bacteria? Taking antibiotics, using mouth rinse, or testing when you have diluted saliva. Now, this is where I found Nathan Bryan, because at the American Academy of Oral Systemic Health, he hasn't spoken there, at the American Academy of Anti-Aging Medicine, I heard him speak, and he was talking specifically about dentists that use mouthwash. Well, you know what? We use mouth rinses that are highly antimicrobial in both our periodontal management and in caries management. It's important for us. What I'd like to do is make sure anybody using these products still has the ability to make nitric oxide. What Nathan claims is many people that are using mouthwash have elevated blood pressure and have other problems because they're not making enough nitric oxide. So he and I got into quite a dispute, as you can imagine, about this, and I wanted to put this all to rest and figure out, I wanted to know what could be the best of both worlds. Because when I have somebody with a dysbiosis, believe me, oral dysbiosis, I'm going after it. And I'm going to use microbials. I might use antibiotics. I'm going to use what I need to alter the biofilm. And I know biofilm shifting is not easy to do. So you can screen for it using this test. It's very easy. A little bit of spit on the end of the test. You can look at it. And I test my patients that are undergoing periodontal management to make sure they're still making nitric oxide. What's the beauty if they're not? I know we've talked about a lot of stuff already, but if you think back earlier, I said one thing. We know how to fix it. We know how to fix this problem. So again, if they don't have the proper support, either because the vessels can't make it or they don't have the right bacteria, what am I going to do? I'm going to give them a methodology to fix it or to supplement to it, basically. Now, I want to let you know and digress for a second. We have testing companies that are continuing to make better panels about the bacteria in our mouths. This is a bacteria panel that you can see on the left for caries. And we're trying to create better metrics for caries. And Kim and I, Dr. Cooch, and I actually worked on putting this together, and it's still not so successful. However, we're working on it. what Nathan did is Nathan, through a lot of research, and Nathan's not a dentist, he's a PhD researcher. He identified the bacteria that we need to have in our mouths to make healthy nitric oxide. Now, I'm going to tell you we don't need to have an expensive salivary diagnostics test for this. We can just use the indicator strip to determine if our patients have enough. And this was the Caries Panel. And why I bring this up, because this is the challenge we're having in medicine right now and in dentistry. I did a panel on this child, and this child's panel came back low risk. But if you look at the radiographs, you'll see this child has a boatload of cavities. So the problem with most of us practitioners is we want a test that tells us what's going on exactly. And I can tell you it's not going to happen. What we need is we need to have the ability to interpret these test results and to make sense out of the data as we get it. So as we start to come closer to the conclusion of this, I want to let you know there's good science that if you reduce, that shows if you reduce the nitrate reducing bacteria, you can affect blood pressure. And I put these papers in so you could see that, because this was Nathan's hypothesis, that nitric oxide, oral bacteria, and blood pressure have a relationship. And I don't want to raise anybody's blood pressure, but at the same time, I want to make sure that I take care of the dysbiosis. So again, this study showed that if you do use antiseptic mouth rinses and you do reduce the oral nitrate production by eliminating these bacteria, you can change the systolic blood pressure. And I can tell you it's not a lot, but it's enough, because there's some blood pressure medications that actually don't move blood pressure that much. So again, recycling of these endogenous nitrate by oral bacteria is an important role in plasma nitrate levels that have control over blood pressure. And again, because we know up on the left, 1 out of 3, on the right, 1 out of 3 Americans have hypertension. And even though they're treating this hypertension, some people still have high blood pressure. We know there's discoveries about the oral microbiome that we think are going to provide new therapeutic targets for us for a number of ways. But what I know is, and what we know is, that if we change the profile of the oral bacteria through antiseptic mouth rinses, we can change blood pressure. Now, many of you, some of you might have been on my webinar. We did a webinar last night on systemic antibiotics, or 2 nights ago, systemic antibiotics and periodontal disease management. And what you would learn on that is that if you have a dysbiosis, too many pathogenic organisms, you're going to have a blood pressure issue as well. So we know we got to fix it. So again, management of hypertension through the maintenance of the oral microbiome is a new paradigm, and we need to think a little bit about it because we have an effect. Also, I'm not going to get into this too deep, but if you have carotid intima media thickness, or this is actually blood pressure, this still is showing that if you can fix the nitric oxide issue by giving somebody a tablet or a dissolvable lozenge that would replace the nitric oxide, could you affect blood pressure? And this study showed that yes, you could. And actually, Mark Houston had a role in this study. Nathan Bryan had a role in this study. And what he showed is that if they invented a lozenge that would replace nitric oxide, and it would normalize and help lower the blood pressure, especially for people that's using any kind of rinse, or if somebody had endothelial dysfunction or that kind of thing. So it's really quite fascinating. And I don't want to get into brand promotion, but there is only one product out there right now that does this, and it's called Neo40 Professional. It's got to be professional because this has something in it that sidesteps anyone with a bad MTHFR gene. So again, what this is, it's a source of it contains these natural sources from beetroot and some unique chemistry that bypasses the endothelial system, and this will replenish the nitric oxide, and it will help boost the immune system to make you more viral resistant, to make you avoid some of these chronic diseases. I do this myself a couple times a day. Anybody that's not eating enough vegetables and fruits, Anybody with the MTHFR gene mutation, and this bypasses the eNOS system. So this is a nice way to replenish, and you can measure that. It'll also help carotid intima media thickness, which is amazing. So that's a good thing as well. So it will affect the thickness of the carotid, so we have studies for that. I also want to assure you that there's other studies that show that this product will help with C-reactive protein, again, blood pressure, triglycerides. It will help with hypertension. And again, it's important to note and to think about when you're changing people's oral microbiome, when people are aging, when they're not eating properly, poor blood sugar management, there's probably going to be a nitric oxide issue as well, and we might want to think about that and looking at that. We also could have our physicians, or we could in our office, look at this arterial pulse wave. I don't want to get into this in the interest of time, but I just want to show you something that happens. We look at this pulse wave, and the pulse wave basically tells us if your arteries are healthy or your arteries are unhealthy. This is the simplification of what happens here. And this is like a finger probe. You just stick it on your finger, and in 3 minutes you get this, this report. What the company has done a lot of research on is if you replenish nitric oxide and you fuel the endothelium with the appropriate nutrients, either because they're missing in the food or your body can't make it, you can change the pulse wave back to a wave of health. And you can take somebody with poor pulse wave analysis and you can create better health. You can reduce the intima media thickness, and you can regress some of the cardiovascular disease. Some really cool things that we can measure over time. And I'm not going to get into the details of it, but I've included a couple things so you could either do a video capture or you could look more into this, because this is a whole topic in the heart disease section, so I don't want to get into it a lot. So what kind of opportunities do we have in dentistry? Look, we can test the mouth with indicator strips. We can evaluate the oral bacteria for periodontal dysbiosis. We can look at endothelial dysfunction by looking at either blood biomarkers, pulse wave analysis. Our doctors can help us tell us that. And we can look at vascular stiffness. That's important. And in the event that we need to supplement, we can pick a couple different products. And if you go online and you look up nitric oxide, you'll see a million products. I'm gonna encourage you to consider sticking to products that have good science behind it, that have research, and that have good product and brand development. So the questions that we need to answer, and I need to think about every time I'm looking at a patient with disease, I wonder if their eNOS pathway is working. Here's what affects it. I wonder if they have the dietary building blocks to convert these foods. Here's what affects it. I wonder if they have the right kind of bacteria. Here's what affects it. If they don't, oh yeah, how about the right amount of acid in the gut? How many people are taking PPIs? How many people are taking antacids now over the counter? This could affect it as well. If they have all those questions and they're answering them in a way that looks like they could be deficient, what am I going to do? I'm going to offer them the opportunity to replenish the stuff, that's for sure. So I hope you understand now why a Mediterranean diet may be so effective. All that stuff might not be, it might be in those plants, but we need to convert it. We need to convert it to nitric oxide and some other healthy building blocks for health. And I'd love to come back at another time and talk about any of these other areas of dietary management and what we can do in dentistry. And again, in our Wellness Dentistry Network, we've created a health measurables that matter for every module, and we start to educate our patients why mold's important and why yeast is important and hydration and exercise and all that stuff. It's really nice, and how we should learn this is bite-sized pieces. So I think the time is now in wellness dentistry. We have a great opportunity to start to educate ourselves, so when we do come back to our new normal, not normal, our new normal, that we will be ready to help. There's a lot of value you can add to your practice. You can create distinction. You have good opportunity. I think you can do more. You can do more for your patients. However, here's what I implore you to do. You have to be healthy yourself. You have to be healthy yourself, and this journey really starts with you. Now, before we get into Q&A and some comments from our panel, This process and the wellness movement is successful, and here's why. 3 simple terms. It is unique. There's still so many people not even thinking about this. It's unbelievably relevant for health and wellness, and it just happens to be that we're research oriented and it's true. So when you have those things together, it's great, because what you get to do as a result of knowing some of these things is you get to offer your patients a million wishes, because you know when you're healthy, you have a million wishes. But I can assure you, if me or somebody in my family becomes sick or gets stricken by this virus, I just want one thing. I just want them to have their health back. That's for sure.
Thank you,
Hey,
Dr.
thanks,
At
Doug.
this point, I want to turn the
I've
panel
got,
back over
Kendall,
to
I've got a
Kendall
couple
and
of
Kim,
notes
and I'm
here that
happy
I
to
took.
answer
I just wanted
questions and
to
interact
share
any way,
real
and I'm
quickly
here for
with
as long as
everybody.
you want to stay.
Doug, it was really, I think, appropriate for you to mention John Coyce and that whole risk assessment-based diagnostic system that he's put together, which I think is really unique and critical. And if anybody hasn't studied with him, I would certainly make a recommendation to go to Seattle, because that certainly changed my career path and my life. The other thing, Doug, I wanted to point out, a study was just published 2 weeks ago, actually, from the University of Plymouth in the UK, and the researchers determined that using chlorhexidine rinse once a day for 7 days, so a lot of people are using chlorhexidine still in the dental profession, and one of the things the researchers pointed out was in light of the COVID-19, a lot of dentists are having patients pre-rinse with an antimicrobial rinse before they work on them. And so they were investigating chlorhexidine, and here are the outcomes. It altered the microflora, and the end result was that it decreased the pH of the biofilm, which we know is a bad thing in terms of dental caries. It also reduced the nitrate production and the conversion of nitrate to nitrite, and as a result of that in these patients, they saw a significant increase in their systolic blood pressure. So this is another clinical trial. When you were talking about, mouth rinse and how does it affect, blood pressure, here's a study that was published just 2 weeks ago, again, supporting that concept, and they were focused on chlorhexidine. Now, one of the things that Brad Bales talked about on our webinar Monday was the value of salt and the chloride ion in terms of production of the hypochlorous ion, hypochlorous acid, for our immune system in terms of killing pathogens in the mouth and the nasopharynx. And we've had great success, I think, and I know you've had great success with the sodium hypochlorite, the carie-free treatment rinse, and maybe not only is it a broad spectrum safe antibiotic, but it also, has the hypochlorous ion in it, so that it's, helps, I think, aids the body too in terms of being able to produce that and fight pathogens. So I just wanted to bring up those two things. I think we always get, I love the child that the reference that you brought out. I think all too often we always want to think that dental caries is a bacterial issue, and I looked at that and immediately my brain went to, that's a dietary issue, probably sugar in solution, and that's one of the things about risk assessment, is learning that it's not always, we always are trained to think in one direction, one dimension, and it's really multidimensional. And that's, Doug, what an amazing presentation. And I'm sure you've got a million questions out there, but I just wanted to add those couple of notes that I took while I was listening to you. So thanks, Doug.
Yeah, Kim, I want to, if I could just comment a little bit. Number one, please forward me the study. I didn't see the new one out of the UK, but I would like to look at it. And if we're concerned about elevating the blood pressure due to changing the antimicrobial issue, it's really simple. Give your patients a lozenge twice a day that can replace the nitric oxide, so we don't do that. Because one of the studies I referenced, in the interest of time, I went through it a little bit quickly, but one of the studies I referenced shows that lozenge will renormalize that blood pressure. So we can counteract that. I would tell you, Kim, that rinsing with chlorhexidine for me would not be favorable. I mean, chlorhexidine, can give rise to some allergic reactions. It impairs fibroblast development. It has the wrong pH. And you already know, I went to the office that was closed. My office is closed, obviously. I unlocked the door and I walked back to my supply room and I bought 4 boxes of Caries treatment rinse home to use, because I'm not rinsing with chlorhexidine. I'm going to rinse with CTX4 treatment rinse. And then I think, to Brad's comment on Monday, and obviously he can speak much more to that literature than I can, but the that research that was done on children with colds and influenza and other variants of the coronavirus, it's very effective. So these are things, the literature is all pointing in the same direction. We have incredible infectious components in our nose and mouths that can be mitigated, and it's all pointing to the same thing. It's all pointing to hypochlorous acid, sodium hypochlorite, these heavy antimicrobials that we need for health and wellness. The other reason why I would use sodium hypochlorite, and Kim, I could go on, you need to stop me because I could go on for half a day about this, would be all of Dr. Slotz's literature about how sodium hypochlorite suppresses viral expression. So if you want suppression of viral expression, and where I worked on that is around the teeth. If you want, lack of viral expression, then this is a critical component to use. So it's it wouldn't matter if I was doing this lecture with the Carie Free Company or any other company. My comments would be the same.
For both of your comments.
Thank you for bringing that up.
You both always do such a great job laying this out. And you're right, we have a million questions coming in. So I'd also like to take a few more minutes to answer those questions. For anybody that's participating with us, if you have to log off, please go ahead and do that. Don't feel like you have to stay on. I know we are over time. Everything is being recorded, so if you have to leave and you want to go back and listen to it, you will get this in the recording as well. Oh yeah, go ahead, Dr. Thompson.
Yeah, and Kendall, I just want to offer you something. I don't know what the how much breakup there was in the video feed, but just as an offer to you and all your participants,
really
if
nice
you wanted
of
me
you.
to re-record this, I'm happy to re-record it, so that if there was any loss, I'm happy to redo that for you if you need me to. And I don't mean live with you. I mean I'll re-record it and you can put the video up
Thank
if
you.
if you need
We'll go
that.
back and
So
listen
I
to
don't
it.
I'm only
think
on
we
my
got
end,
you in
so I don't
pretty
know
clear audio
how
for
much
the
breakup there was,
majority of
but
it. I think
if
the
it was
last 40
disruptive,
minutes was pretty
I'm
good.
happy to do it over for you.
But we'll go back and check it out, and I'll work that out with you. So having physician involvement is key with all of this. Partnering with the medical field, we've had presenters from the medical field presenting with us from the Bill and Doneen Center. Dr. Thompson, do you have tips for partnering with physicians?
Yeah, one of the things that I think is great for us to do is when we are treating periodontal disease, I outline conclusively, and the literature supports, if you really, really want to be effective treating periodontal disease, which is a very hard disease to treat, adding systemic antibiotics really helps a lot. But you're going to have patients in your practice that have other health issues. So one of the polite things you could do is almost all your patients are going to have a physician of record, or they're going to have somebody in the community. And if they don't, you have an opportunity to either refer them to one through telehealth or telemedicine. There's a lot out there. That's why networking with some of these groups, we have a list of partners in health that help us. That's for our members that help them can get the help they need. And so I think reaching out to physicians and having a very nice conversation with them about how, I have a patient, your patient, they're sitting in my chair, and I either need to, I would like to dialogue with you about the use of antibiotics, or I'd like to dialogue with you about something else related to their health. is a real nice way to break the ice. What I think is harder, Kendall, to do is to call a physician and to tell the physician how valuable you can be to their patient, for their patients to be healthy. I think that always comes a little bit arrogant. And so I've been very successful developing relationships with physicians by asking them for help, asking them to help me manage this patient. Or I have a patient that seems to have an elevated A1C. Could you help me take a deeper dive into their glucose management? And physicians have been very, very accepting, because it's easy to work with a Baldonine trained physician because they already know the language. But when you're approaching physicians that don't know, asking them for help is a polite way to find out how willing they are to work with you, and I can guarantee you it will not take long. The physicians are hearing more and more about dentistry and more about how valuable we can be, and quite
That's
likely
really good
you'll get
advice.
this comment. I've been waiting
We
for
have
a
another
dentist to call me. I'd like to learn a lot
and
more
we've
about what
actually
you
had
guys
two
do.
people that would like this one
And gals
answered,
do.
so it sounds like
that's
more
how I
people
would
might
do it.
have this one. From Tom, what are your opinions on using clear xylitol nasal spray, and clear the brand, nasal spray during COVID-19 to increase nasal breathing?
I think anything that you can do to enhance nasal breathing, including lip sealing at night or mouth taping, anything you can do to encourage a clearer nasal passage would make sense. I think you had a beautiful webinar on Monday talking about the use of a concentrated 3.5% solution of saline. And I think right now with the COVID virus, the saline irrigation with a neti pot, with a however you do it. There's a video. I know that on Baldonine.com there's a video on how to do that. I think that would probably be better to do right now. However, xylitol is a biofilm buster. It doesn't promote the growth of certain species. We use a xylitol-based nasal spray with mupirocin and itraconazole in it as part of our yeast management protocol for our Wellness Dentistry Network. So I totally am for it. I just think there's a couple things you could do right now that might be a little more effective. So I would go on to Baldonine.com or get I would get that paper. We're happy to send it to you or reference that. I know it's the webinar on
good.
As part of this continuum.
Another one,
that,
so I'm going to
that they can
combine
watch.
these two
That
questions.
I would do that,
With
but
so many different
not
diets
wrong.
out there and our patients coming in to, practitioners on a wide range of different diets, will you speak to what are your opinions on patients on a ketogenic diet, and then also how does fasting affect nitric oxide?
Yeah, the what I hope was evident, and if you missed, if some of the beginning of the presentation wasn't so clear, is that these concepts have to be personalized. We have to find out what works for us. So the problem we're having right now is we watch Good Morning America or we watch some kind of show, and somebody comes on and talks about the benefits of a particular kind of diet. I've preferred to call it basically an eating style. And what most of our bodies benefit from the most is some variation in those styles. And so you'll have concepts like a Mediterranean diet, and all that really means is eat more vegetables and eat more things like they grow. And if you're a meat eater, supplement it with a very clean and lean meat protein that hasn't been a heavy use of antibiotics and pesticides and that kind of thing. And so I think I want to move away from, and I don't want to address a ketogenic diet specifically, because I think that should be decided by a health coach that where you have specific end goals of therapy, and it's typically a dietary lifestyle that you're not going to keep on indefinitely. I mean, you're not going to be able to live on that indefinitely. What you can live on indefinitely is eating however you want, And I showed a study about periodontal disease management with a diet low in carbohydrates, rich in vitamins C and D, rich in omegas, and with moderate fat, only healthy fat intake. And these diets will suppress inflammation. The other thing that will suppress inflammation is giving your body a timeout from food. And we can do that a number of ways. One, we can practice what they call intermittent fasting, which means keep your food intake into an 8 to 10 hour window a day and don't eat outside of that window. And if you start to think about that, if you get it into an 8-hour day, it's pretty short because that means you're not eating the rest of the time. And then the other concept, which I'm also a big fan of, and I can help you learn more about it, is the Prolon, which is the fasting mimicking approach. And what that does, when you starve your body for a controlled amount of time in a controlled way, your body goes into somewhat of a hibernation, repair and regenerate mode. And this is when you'll have lower inflammation, you'll have you'll decrease your triglycerides, you'll decrease your cholesterol, you'll decrease your HSCRP, you'll have health benefits, you'll increase stem cell development. And this happens, and I have metrics on that stuff. I've studied those things, and that's why what we teach are a variation of different eating styles, so you can educate your patients about different ways that they could take a dietary approach. And we actually sell Prolon in the practice, and we coach and support these different ideas because not one shoe fits everybody.
And what I'm realizing is that
I
we
think we
need
know
you
that
on
by
for
now.
about 4
So it
more
needs to be
presentations.
personalized,
So
and
if
that's
you
what I want to
don't
be careful
mind,
with. I hope that answers the
we'll get
question.
those booked after today.
We could talk all day on that too.
I do. Okay, so there's one more question, and I think we'll end on this one. I think this is really relevant in terms of our situation right now. If we're doing more teledentistry after the COVID pandemic, if that becomes part of our new normal, are there suggestions you can make on how to evaluate patients if we can't measure everything in office?
Yeah, that's the foundation of the home dental exam for patients. There are some pretty slick approaches right now using either your iPhone, even the software that Dr. Coy's has developed or has been part of developing. It's not his, but it's part of it's his, based on his diagnostic platform called Oryx. What these programs are doing is they're allowing us to go online to answer questions, health history questions, and we come up with an oral health score. As a matter of fact, this would be a good time, if people haven't done it, would be to go to the internet and actually experience your oral health score, because it's an app that they can, and I'll make sure that I'm stating the app name properly, but it's an app that they can go on, people can go on and they can answer questions. And what does it give you? It gives you a risk assessment. So, and it's actually called the Healthy Mouth app. And it's very Koi Center content heavy. But the idea is, it's built off the concept of looking at health history data and dental history data that comes in on our normal questionnaires that we would use in practice. Now, these are specifically questionnaires that have been developed at the Koi Center, and it risk stratifies where the patient's issues might be. So I can tell you with a couple photos and with a risk stratification based off some good dental and medical questions, that's per the design of the questionnaire, you will have a very good idea of what's going on in that patient's life. And I think that's really amazing. So look up the Healthy Mouth app, and you should see a symbol that's representative of the Koi Center's logo, and you're in the right app. And when you go through those questions, it's going to give you a risk assessment. So part of our oral assessment, if you're going to try to do it over the phone, You would need some good questions, some good health questions. You would need some lifestyle questions, and you would need some dental questions. And they need to be questions that will funnel into a risk predictor. And from that, you could add a couple photos. And then if you could get some medical metrics, like some, whether it be medical metrics, or you could get a salivary diagnostics test. That's what we're doing with homedentalexam.com. You could then take that information and you could provide a pretty nice interpretation guide. Then we want to connect our patients to a virtual hygienist so that they can get hygiene training and they can have a healthier mouth. That's where we're going in the future. And that's just with the hygiene side of things. There's other things we can do as well. We obviously can't do a filling. We can't do restorative dentistry. But we might be having patients come into our practice, and we could be doing that very differently in the not too distant future.
Yes, absolutely. You're always a wealth of knowledge.
More gowns
I did
and
post the
masks
name
and
of the app in the Q&A box, so that will live there for people if
so again, I hope
you
that
want to
answers
grab
that question.
I also wanted to let people know we're going to have Patty DeGangi, a hygienist, speaking with us on next week on 4/16, on April 16th, and she is going to be discussing teledentistry and what that's going to start looking like moving forward. So feel free to hop on to that course when she teaches it as well. Okay, just oh yeah.
Yeah, and Kendall, I just want to give a plug for Patty. I actually work with Patty. I'm working with Patty as well, but Patty is an amazing person in dental coding and that whole understanding of that piece. And she's been a great ambassador to the people who are creating codes
and we've had quite a few questions today about medical billing and coding and all of
in
that.
the medical arena. So I applaud Patty.
People asking those questions, that is, and we do have a speaker tomorrow that will be talking about billing and coding right now, medical billing. Okay, so just a few items to mention. Recording, we will be sending it out via email this Friday. It'll be posted in our Facebook group. It's also posted on our landing page, cariefree.com/CONNEXT. So you can find it there. CE, the quiz and evaluation form, will be sent to you today. Once you complete them, we'll get you your certificate within about 1 to 2 weeks. Join us tomorrow for Candor Sellers, talking about why medical billing is more important than ever. And on Friday, we're wrapping up the week with Dr. Julie Kellogg and Dr. Karen Tyndall discussing coaching for generations in crisis. With all of this, thank you, Dr. Thompson. Thank you to all of our attendees for being on with us today. We hope this hour continues to bring you joy. We really appreciate your support because we wouldn't be able to do this without all of you. So that takes care of everything on my end. Dr. Coots, do you have any final thoughts?
I just want to say thank you again so much, Doug. It's good to hear your voice. Be safe, everybody.
Thank you, everyone. Take care.
You're welcome, Kim. Thank you. Nice to hear from you.